There are some consequences of inefficient offices. You have staff doing work that could be done in minutes. They will be doing that for several hours. And the pain points are really patient-centric.
Welcome to the Physician Growth Accelerator, a show where we break down your private medical practice systems into vitals, give you the tools to diagnose root cause of what may be restricting your growth, and prescribe what to do about it. I'm your host, Zed Williamson, and I believe that everything we experience in business and in our personal lives, it is all the perfect outcome of our current systems. And if we can understand that, wrap our head around that idea, then it puts us in control. And if we want a different outcome, then we just have to tweak the system. Now, in dealing with medical practices, sometimes you can lose sight of really what the purpose of a medical practice is. And beyond everything else, the most important thing is thinking patient first. And that's why we're speaking with our guest today, Dr. Amos Dare. He's a neurosurgeon and founder of MedMatch Network. Amos, thank you so much for joining us today.
My pleasure. Thank you for having me.
So you have created something that's really interesting, and I want to get into it in a minute, but I would love the audience to understand from a founder's perspective, what was the problem you were looking to solve that you were witnessing in this space and keeping that idea of patient first?
Right. So I'm a neurosurgeon and I am a specialist. And what I encountered was patients coming into the office, and it could be that they're in the wrong office or the wrong specialist office. Neurologist, urologist, neurosurgeon sort of rhymes. So sometimes
Yep.
they end in the wrong office, or they're waiting in my waiting room for at least an hour before I see them, either because of insurance authorization issues or simply waiting for records. And very often patients just get lost or they are not reminded. So I told myself, how can I make the process more efficient? And that was coming from a specialist office and trying to communicate with my other providers, the primary care physicians who are referring these patients to us. If these patients could be better informed, if these patients could be better qualified, then it will make it very different experience for the patient and for me as well. So this is how the journey started. It's just the bottlenecks and the difficulties of coordinating patient care.
Yeah, and there are so many. I mean, if we were to start from scratch, you would never design the current process to be a patient-first process the way it currently is, where the idea of a patient typically waits too long to talk to any provider about what they're doing. If they end up at a primary care, that primary care is likely over, they're beyond capacity, so they're not able to spend a ton of time with these patients. The guidance for that patient sometimes can feel frustrating because they feel like they're being shipped around to different places and people aren't communicating, and it takes time and things aren't found. And, well, I thought I had a referral. Well, no, we don't see anything for you. Can you call it's a total mess from the patient perspective. So I like that you're attacking this head on, because it is absolutely a problem.
No, absolutely. It's a problem. And from the patient perspective, I had a chance to experience that as well as I was taking care of my elderly mother. And when I called the office, I said, I'm a doctor. And they told me, no, you're a patient. I said, I'm a doctor. They said, well, you're calling on behalf of a patient. And that meant waiting on the phone for 30 minutes, which was quite a novel experience for me. So just put yourself in the patient's perspective, and it can be a nightmare. And now I will talk a little bit about solutions, but they are definitely patient-centric to try and help them navigate the system.
And we also, if we think about, even from a primary care perspective, trying to navigate your day, refer patients to the right places, there's a lot of things that are happening on the primary care side too, from their mindset. They sometimes they get or they believe they get feedback and that influences where they refer patients. And the thing is, everybody has the same goal in the end. They want patients to feel better, whether it's at this practice, or this practice. And so there's so many little battles that are happening between referring from primary care to specialty. So if you could explain, what is MedMatch Network doing?
Right. Thank you for the question. So, MedMatch Network is a platform that is putting all the providers together and also bringing the patients in that network. So if I wanted to refer a patient to you, if I was a primary care provider, it should be literally at your fingertips, right? You should be able to find the providers that you need, and select them based on their specialty, their location, their availability, and what insurance is on network
Mm,
they take. So that should happen in seconds. That shouldn't take us 2, 3, 4 weeks to figure out. And
right.
traditionally, it can take that long. So having the platform knowledge that is already there facilitates that process. And literally, the patient is walking out and knows they have an appointment with a certain provider on a certain date, and they get looped in the process. So right away, they are engaged. They can go on the platform, answer any questions before their visit. All that insurance hurdle gets taken care of prior to the time of visit, and everybody's informed. So that's what MedMatch is doing.
So what's interesting, I want to put people in the mindset of a patient. We have these pretty fancy brains, but they are designed to survive in a world that doesn't exist anymore. And those biases and heuristics tend to focus on negative and threat. And if we take a patient who's in some kind of physical pain or some kind of limitation, they have less mental energy to try to overcome what their biases and heuristics are thinking. And so if a patient leaves a primary care's office, they attribute the value of that interaction to basically everything medical going forward. And the disconnect that patients think can exist, where why would it take 2, 3, 4 weeks for me to get an appointment? How come they didn't know that who they referred to doesn't take my insurance? Those things really trigger a couple different biases that make it so a patient can even give up in their journey, where they'll just say, well, never mind, I'm not going to go, which we don't want because there was a reason they should have visited the specialist. But also, they will bring that negativity towards any approach to treatment. And, there's one bias called ambiguity effect, which is really fascinating to me. It's this idea that if things are not clear, I'm going to assume worst case scenario. So imagine a patient sees a primary care physician. It doesn't feel clear in regards to how I get to that referred specialist. And now we're going to a referred specialist assuming worst case scenario. We don't want patients in that state. And what it sounds like you've done is created a tool where we can remove that ambiguity, shorten that time frame, and give the patient an overall better experience.
Absolutely, absolutely. One analogy that I always put forth is that we want to restore or at least maintain the physician in the driver's seat and the patient in the passenger seat relationship, right? It's not we want to get away from, okay, here's a script, this is your diagnosis, go find a doctor
Yeah,
in your
good luck.
town. Bye, right? But we want to be able to curate the list of providers that already meet certain criteria about that we know are going to be necessary, whether it's reputation, whether it is location or specialty or diagnosis, any of that stuff can be readily curated and sent to the patient and say, hey, your homework is done for you. Now you can pick from any one of these based on your schedule or at your convenience. And I'm aware of everything that's going on, and I'll see you back. So that type of relationship is what we want to continue to foster because in the age of internet, as you can imagine, patients are taking matters into their hands
Yep.
and don't necessarily have the qualification to do so.
Yeah. If you think back to when you started, maybe even when this was in the idea stage compared to now, what has been the most surprising part of this journey for you?
That's a good question. You know, I don't know if it was Steve Jobs or who said this, but sometimes you have to tell people the problem they have before you tell them the solution. And there are a lot of patients obviously feel the pain. They feel the battle. God forbid you have some kind of diagnosis that you have to see multiple doctors or get tests and tests like that. It's very stressful. But what I found with some of my colleagues was that, um, they were on the other side. And it wasn't until I flipped to the patient side that I actually saw the problem, the issues that are there when patients are trying to navigate the system. Now, there are some consequences of inefficient, offices. You have staff doing work that could be done in minutes. They will be doing that for several hours. And so there are some of those ramifications of not having a oiled machine, so to speak. But so far as the pain points are really patient centric.
Yeah. It's kind of that it can get out of sight, out of mind a little bit,
Oh,
right? Where
absolutely. Absolutely.
and everyone's doing good work and they're busy and they're focused and it's hard to even imagine kind of what's in that periphery. And I really I think that's fascinating.
I
We
mean, I will tell you that one surprising statistics is that 60% of physicians don't know if their patients actually saw the specialist they refer them to. They don't know until they get a report or the patient comes back and said, "Did you see this doctor?" I said, "Well, things got things fell in the crack, up to 60%." So that's a staggering number.
Yeah. And we can't say that that's good for humans,
No,
right? That's
no, it's not good. It's not good. From a physician point of view, things that should be done efficiently, you know, start becoming things that are burdensome. And there's reputation at stake. Um, there is also a way to grow your network on the platform, right? And the more efficient you are and the better reputation, the better referral network you'll be able to build. So there is a way to actually grow your practice on the platform if you're doing well. Returning your reports on time, connecting with patients and the providers that are sending you their referral. They want reports. They want to be in touch. They want to
yeah.
know how their patients are doing. So it benefits a provider to really provide good patient care. That's what it comes down to.
So if there's a specialty physician out there and they're hearing this and they're wondering, okay, so if they join this network, what can they expect?
When they join this network, number one, they will be able to connect to other providers that are become their life vein or lifeblood, if you will, because these are the providers that are going to be referring the patients. Specialists will be able to get properly qualified patients, right? Patients that need your help. These are not patients that are going to waste your time or not be the right patient for you. There'll be patients that are pre-qualified. So that improves the number of qualified referrals that you have. And by having a platform that you can easily track your referrals, connect to the providers that are sending them to you, you provide better care. Now, one thing that it's a problem, it's a very ubiquitous problem, is medical records, access to medical records. And the platform also securely hosts medical records. So that means that if you need some records to understand what's going on with the patient, those records are going to be available to you readily. If the patient has already had some tests before they come to see you, you have access to those results, and you don't have to order those tests again and again. The problem of medical record aggregation and central aggregation and having everybody, including the patient, having access to it is a one big problem for us because the patient is really distilled down to medical records. If you don't have the medical records, you could be staring at the patient and spend a whole day trying to understand why that patient is here. So that's something that the platform also does for the specialist.
Well, I think this is really good. I appreciate the work you've done. I know it takes a lot to take an idea, turn it into something real, and then actually get it live and working. And it's exciting to see what you've done with MedMatch Network. If listeners, imagine there's some physicians out there, if they have questions, is it okay if they reach out to you through LinkedIn? Is that an okay approach?
Yes, absolutely. I'm on LinkedIn. Just look me up by my name. And also I can be reached from our website, which is medmatchnetwork.com. And yeah, I should be foundable.
Yeah. And we'll put links to that in the show notes for easy access to both your LinkedIn and to the website. And Amos, I really appreciate you spending the time and joining us today. It's really congratulations on what you've done.
Thank you very much. Again, thank you, Zed, for having me. I've enjoyed the talk very much.
Absolutely. And we'll see you next time on the Physician Growth Accelerator.
Thank you.